Good afternoon, everyone, and welcome to the third meeting of the Legislative and External Affairs Advisory Committee. My name is Robert Callan, and I have the honor today of serving as the vice chair of this committee. Chair Bontrager is out sick today, and I will lead this meeting in his absence. Now we will take roll call and establish a quorum. Please note, under the Bagley-Keene Open Meetings Act, any commissioners who are participating remotely must keep their cameras on at all times and will be asked during roll call to disclose if they have any other adults over the age of 18 in the room with them during the meeting and the nature of their relationship with these individuals. Chris Hunji, please take roll.
Commissioner Fairweather.
Here, and I'm alone. No one's with me.
Commissioner Hill.
Here, and I'm here alone also.
Thank you. Commissioner Larson.
Present.
Commissioner Mitchell. Marking absent. Commissioner Southard. Marking absent. Commissioner Thomas Beckett.
Here.
Committee Vice Chair Callan.
Here.
Committee Chair Bontrager. Marking absent. We have 5, so quorum is established. Thank you.
Thank you, Chris Hunji. Now we are moving to agenda item 2, announcements. Now, before we begin, I want to remind everyone that we will be abiding by Bagley-Keene laws for these meetings. But as part of our commitment to the deeper public involvement in open governments, all advisory committee meetings feature an enhanced public comment segment designed to promote genuine dialogue between the committee and the community. Moving to recent contract amendments, in line with our BHSA implementation, the Commission worked with existing advocacy contractors to include and prioritize work with members of their population that also identify as members of the priority populations as defined in the BHSA. Advocacy staff met with grantees to amend existing contracts to require them to include BHSA priority populations in at least 50% of their activities, as well as include reporting that work in their quarterly and annual reports. Specifically, annual reports must now identify 3 to 5 recommendations for policy work that revolves around priority populations. Contracts are currently being executed, and the new reporting is anticipated to be reflected in their winter quarterly reports. Now, the 2026 legislative session begins on January 5, 2026. The legislators' tentative legislative calendar and deadlines for next year is included in the packet. Lastly, the full commission plans to have a 2-day meeting in January, held on January 22nd and January 23rd in Sacramento. For more information on any of these items, please visit our website and sign up for our email distribution list. That concludes our announcements for this morning. I want to again welcome everybody to today's meeting. All right, now time for agenda number 3, general public comment. This time is reserved for comments on items that are not on the agenda. Lester, please lead us to public comment.
Thank you, Vice Chair. If you'd like meeting transcription, live meeting transcription or closed captioning, please activate the closed captioning feature located in the control bar at the top or bottom of your screen. If there are any members of the public using translation technology, please notify the chair so that we can be mindful. You may request to make public comment by submitting a card, clicking the raise hand icon on your computer or the app, or if calling in by phone, push *9. Members of the public can also email us your public comment to be shared at a future meeting at publiccomment@bhsoac.ca.gov. We have 3 virtual public comments. The first public comment is Laurel. Please go ahead.
Good afternoon. I'm Laurel Ben Hamida with Muslim American Society Social Services Foundation and REMCO. I understand that the Commission is going through a new process, many new processes, and one of them is the enhanced public comment. And I really appreciate that. that was sort of a promise given to stakeholders when no members of the public were included on committees as they had been in the past. But a promise is a promise. And our last meeting this morning didn't fulfill that promise. The commission was tight on time. Public comment was reduced from 2 minutes to 3 minutes. And there was no discussion after one important item, the one on the Innovation Partnership Fund. So my suggestion is that you add 15 or 30 minutes to meetings so that you can fulfill your promise to stakeholders, and at least 2 to 3 minutes for public comment. And after an initial public comment, if you really want to have interaction, it needs to be more flexible. And for us, the stakeholders, we need to make our comments concise, clear, and have impact so that we can incentivize and encourage and inspire the commissioners to respond. So thank you very much.
Thank you, Laurel. Next comment is from Stacy. Please go ahead.
Or good afternoon, Stacy Hiramoto with REMCO, the Racial and Ethnic Mental Health Disparities Coalition. Welcome. I want to really echo and support the comments of Laurel Benhamida. Again, we really do appreciate the commission trying its best to get public comment, but there was very little dialogue, so to speak, and certainly the public really wasn't able to express itself very well at the last meeting because of lack of time. The other thing, so if we could think of things in the future, I think still having a public member that can express the things so you won't have as much public comment because they will be, their wishes will be expressed by people on the committee. The other thing is I just wanted to have the commission remember that for communities of color, they consider people, they may have different definitions of Prop 1 as far as who are the priority populations and who has the most serious need. Anyway, thank you. I want to be brief, so I will stop. Thank you.
Great. Thank you, Stacy. And our final public comment is from Carly. Please go ahead.
Hello, good afternoon. Carly Stelzer with the California Behavioral Health Association. Want to uplift the comments made by Laurel and Stacy from REMCO so far. We also want to express our appreciation to the new process that the Commission is working through and the ability for the public to participate in these ways in the committee and particularly in shaping the legislative priorities for 2026. We know we'll talk more about it in the later sections of this legislation, but want to echo comments made about the need for there to be more robust stakeholder engagement and a back and forth communication process that would allow behavioral health providers to have a seat at some of these conversations. Look forward to more public comment later in the meeting. Thank you so much.
Great. Thank you, Carly. And Vice Chair, that was your last public comment.
Great. Thank you, Lester. And thank you, everyone, for your comments. It's now time for item number 4, approval of the September 18th, 2025 Lex Advisory Committee meeting minutes. At this time, I would like to invite commissioners to offer comments or ask questions. Lester.
Oh, I'm sorry. There are no public comments.
Okay. No public comment as well? Okay. Thank you, Lester. Now that public comment has closed, I would like to entertain the motion that the Commission approve the September 18th, 2025 LAX Advisory Committee meeting minutes.
I'll make the motion.
I'll second.
We have a motion and a second to approve the minutes. Are there any additional questions or comments from commissioners? Seeing no more comments from commissioners, Krisan, please call the roll. Thank you.
Commissioner Fairweather,
Yes. Aye.
Commissioner Hill,
Aye.
Commissioner Larson. Aye. Commissioner Mitchell. Marking absent. Commissioner Southard. Marking absent. Commissioner Thomas Beckett.
Aye.
Committee Vice Chair Callan.
Aye.
Committee Chair Bontrager. Marking absent. The motion passes.
Thank you. Now let's move on. Agenda item 5 focuses on upcoming 2026 legislation. Today, the Commission will hear staff's recommendation for the bill proposed for Commission sponsorship in 2026, following our fall call for ideas. Deputy Director Kendra Zoller will present the proposal, summarized staff analysis and its alignment with our decision-making framework, provide a recommended course of action, and outline next steps for Commission consideration and formal action. We are pleased to welcome Commissioner Madrigal-Weiss and Heather Newmore from the San Diego County Office of Education, who co-authored this proposal and will join Kendra to present data and rationale that informed the recommendation. At this time, I'd like to invite Deputy Director Kendra Zoller to kick us off.
Thank you so much. Good afternoon. I'm Kendra Zoller, Deputy Director of Legislative and External Affairs. Like the chair said, we're very happy to have 2 guests today, if they'd like to introduce themselves.
Thank you. Good afternoon, commissioners. Good afternoon, committee members. I'm Ana Madrigal-Weiss, commissioner with the Behavioral Health Services Oversight and Accountability Commission and executive director of Student Wellness and School Culture for the San Diego County Office of Education. Very happy to be here.
Good afternoon, commissioners and community members. I'm Heather Newmore, coordinator for Student Wellness and School Culture at San Diego County Office of Education.
Okay, so before we discuss our proposal, I'd like to bring you up to speed on how the idea for this legislation came about. As you recall, on August 1st, 2025, the Commission issued a request for bill proposals guided by the decision-making framework for legislation that we discussed in this committee in September. 22 proposals were received from stakeholders, commissioners, staff, organizations, reflecting key themes such as crisis response, workforce, youth behavioral health, veterans, and equity. An overview of the legislative landscape and early proposal concepts were presented at the September 18th Lex Committee. And after applying our framework and vetting the proposals, we have been developing a bill proposal for the 2026 legislative session aimed at addressing statewide need that I'll go over next, while also aligning with the Commission's core values and priorities. This proposal, titled Sustaining and Supporting Suicide Prevention in Schools, was submitted by Commissioner Madrigal-Weiss, who supports San Diego suicide prevention efforts in schools, and alerted us to the need to expand comprehensive evidence-based efforts across the state. The proposal has 2 main parts: to develop free online suicide prevention training for students, teachers, and parents and caregivers, and 2, creating a statewide system to collect and analyze school suicide risk screening data. Today, we will review the problem, proposed solutions, and the supporting data for each part. The data related to this proposal not only clearly shows the need, which we will discuss shortly, but also aligns with our legislative decision-making framework, which I will quickly run through next. So here's our framework, as you recall. And we determined that this proposal aligns with the framework. For alignment, this proposal builds directly on the Commission's prior work and policy recommendations on suicide prevention and on school behavioral health through our Behavioral Health Student Services Grant Program. It also advances elements of California's behavioral health transformation that focus on schools and preventing suicide. We have also heard that many counties are reducing local suicide prevention efforts, and while the California Department of Public Health is taking on aspects of prevention funding, some substantial uncertainty remains. So given that context, Commission involvement here would be timely and complementary to those efforts. The proposal further supports our strategic plan by translating our vision into action, codifying best practices for suicide prevention, and establishing expectations for outcome measurement. In terms of impact and equity, offering free, accessible online training for students, educators, and families promotes equity of access, and a statewide approach to collecting school suicide screening data would generate system-level insights and trends that can inform targeted interventions. The potential reach into schools is large, and because suicide is a serious and time-sensitive issue, urgency is warranted. We have identified potential funding through our Behavioral Health Student Services Act administrative dollars, which was heard earlier today in the PAC committee. And we have begun some initial conversations with other relevant state departments, which supports a coordinated prevention to recovery approach. And for landscape and value section, the stakeholders we've consulted are supportive and view the commission as well positioned to add value. This proposal is not duplicative. It builds on prior efforts that require sustained investment to achieve long-term impact. I also just want to add here a reminder that for the other proposals that were submitted, we did get back to all the submitters. As you may recall, a lot of them were actually more funding requests or administrative efforts, but some of them are good ideas that just need more vetting, more data, and so we're still working on those. There's a couple we'll probably bring forward next year, so I just want everyone to know those are all still great ideas and in play, but for the reasons we'll go over today, this one is really ready for next year. Okay. Let's talk about why sustaining and supporting suicide prevention in schools is so necessary now more than ever. I'll quickly go over current law to give you the background. California law currently requires all K-12 schools to adopt a suicide prevention policy that specifically addresses the needs of high-risk groups, which includes prevention, intervention, and postvention. The CDE, California Department of Education, created a model policy to assist LEA's schools in developing their policies. Notably, the policy references the Commission's report Striving for Zero, which suggests that schools conduct and track suicide risk screenings. The current education code mandates that suicide prevention policies address staff training protocols. However, not all schools adhere to the CDE model policy. Therefore, suicide prevention protocols, practices, and policies vary widely across the state, which leads into the problem this proposal seeks to address that I'll go over next. So, as you may be aware, suicide is an enduring issue in California and is the second leading cause of death for youth ages 10 to 25. The overall suicide rate in our state has increased by 8.3% over the past 2 decades. To support suicide prevention in schools, California passed AB 1808, which provided funding to train both school staff and students to recognize and respond to signs of suicide. The San Diego Office of Education, that you'll hear from shortly, led the initiative and allowed for online training called Living Work Start, which was rolled out in 2 phases in 2020 during the pandemic. The program was available online at no cost to schools. However, licenses to access the training were limited and funding for this program has run out. So California schools now lack a free evidence-based training resource. Additionally, although many schools conduct suicide risk screenings, the results aren't shared, aggregated, or used to inform broader strategies, limiting understanding of student needs and targeted support even as youth suicide remains a major concern. To learn more about these initiatives, an example in San Diego, I'm going to pass it to our guests.
Thank you, Kendra. Heather and I are here today to discuss our experience with the Living Work Start training and other suicide prevention strategies in San Diego County. In 2021, the San Diego County Office of Ed was awarded a 4-year, $7 million MHSSA grant, and we called it the Creating Opportunities in Preventing and Eliminating Suicide, also known as the COPES Initiative. This initiative built the capacity of over 440 schools in our county to champion mental wellness by targeting efforts in staff and student wellness and resiliency, stigma reduction, professional development, and programming for educators, staff, students, and families. Coordinated referral pathways for students needing mental or behavioral health services, and of course, suicide prevention, intervention, and postvention practices. The goals of the COPES initiative was to build mental health literacy across school communities.
In San Diego County, 15 school districts, 4 multi-site charter organizations, and 12 single-site charter schools are participating in this 4-year COPES grant initiative. Our suicide prevention efforts are comprehensive, and they include training for staff and families to increase awareness and deepen understanding, technical assistance in developing comprehensive protocols and practices, access to current tools, data, promising practices, and high-quality resources, training and implementation of the Columbia Suicide Risk Severity Screening Tool, and data tracking across over 440 school sites. COPES LEAs in San Diego County collect the number of suicide risk screenings, including grade level, gender, race, ethnicity, severity level, and outcome of the screenings. The California Healthy Kids Survey core module and the, as known as CHICS, and the CHICS behavioral health module are part of the annual data collection process used by San Diego County Office of Ed. In addition to CHICS data, we also collect suicide risk screening data, annual comprehensive needs assessment, records of trainings and activities to provide LEAs with areas of growth and opportunities. Each year, they develop an action plan based on this data. While this data is crucial, not all schools that collect suicide risk screenings data collect or report the data the same way, nor do they ensure staff are trained to use the screening tools correctly. In the last several years, we have identified a youth mental health crisis. Schools are where students spend 1/3 of their time and where we are more likely to identify the warning signs. To prevent youth suicides, we need to identify risks as early as possible using an evidence-based screening tool. LEAs can use this data to identify trends to inform their practices. Data is not about numbers, it is about visibility. It tells us where the risk is greatest and where students are silently hurting. Now, more than ever, we need to go beyond collecting suspensions, expulsions, weapons, and attendance data. We need to collect real-time life and death data. The Living Work Start online suicide prevention training program, whose limited licenses were funded by the passage of AB 1808, reached over 25,000 middle and high school students and staff in San Diego County. We found the results of the training to be overwhelmingly positive. After completing the training, 98% of staff and 95% of students felt confident in their ability to help someone who might be thinking about suicide. 96% of students said they knew how to use the resources if they were struggling with thoughts of suicide. And about 1 in 4 students and staff already had someone in mind they could use their new life-saving skills with. Although San Diego County Office of Ed received requests from parents and caregivers across the state to take this training, the legislation did not include parents, leaving a gap in the students' web of support.
Early intervention in suicide prevention is critical, yet many students, teachers, and parents lack the tools to recognize the warning signs. A free, accessible, and sustainable online training program would enable communities to recognize and support at-risk youth, gain a shared understanding of suicide prevention strategies, reduce stigma, and encourage help-seeking behaviors. Requiring a de-identified aggregate suicide risk screening data would help local school communities, counties, and the state track and monitor regional and demographic trends in youth suicide risk, allowing for data-informed targeted interventions where they're needed most. This will ensure that school-based efforts are measurable and impactful. With data, we can direct support to where it is needed. We can shift from reacting to predicting, from crisis response to crisis prevention. This approach guarantees that school-based efforts are both measurable and impactful. Commissioners and committee members, imagine what becomes possible when every school in our state is equipped to identify risk early, when every educator has access to training without cost barriers, where every parent feels empowered to have difficult conversations, and when every student knows that reaching out for help is a sign of strength, not weakness. Imagine a California where no child feels invisible, where no warning sign is missed, and where help is always within reach. This is not just a policy discussion, it's a moral one. Our students deserve systems designed for their safety, dignity, and the preservation of their lives. By investing in prevention training and statewide screening data, we invest in hope, resilience, and the belief that every young person matters. And that is a promise worth fighting for. Thank you for your time today. I will pass it back to Kendra.
Okay, so we've already started taking important steps to ensure this proposal would be capable of being implemented by talking to our partners, because we don't want to duplicate any efforts. So we've talked to the California Department of Public Health. We're going to talk to the California Department of Education. We've also identified some of, like I said, our BHSSA admin dollars that the PAC committee passed this morning to be able to help pay for this initiative, which helps us with our budget issues. We've actually also received a lot of reach outs from different legislators who have asked about proposals in this space showing interest in suicide prevention, which is wonderful and shows that this is capable of being hopefully passed and implemented. All the signs are there. Looking ahead, we can build on existing online training platforms such as Safe Spaces developed by the Office of California Surgeon General to make the training easy to access and cost effective. So we're thinking of exploring not making yet another platform, but using the platforms that are already out there the Department of Healthcare Services and CDPH are using for different types of behavioral health related training. By working together and using the tools we already have, we can make sure students, families, and school staff across California get the support they need to prevent suicide and save lives. We are excited about this proposal because it builds on the work we've already done to support students' mental health and prevent suicide. We've seen how powerful online training can be in helping students and staff feel more confident and prepared to help someone in crisis. Now we want to take that success even further by making the training available to more people across the state and collecting data to better understand where help is needed most. This proposal also matches the goals in 3 important reports from the Commission. These reports say we need more youth-focused resources, better access to training, and stronger data to inform decisions. Our proposal does all of that. It helps underserved communities, makes suicide prevention training easier to access, and uses data to make sure schools are getting the support they need. That's why I believe this is the right next step. Okay, so with all of that, our recommendation is that the LEX committee recommends moving forward with this proposal for the 2026 legislative session. We are happy to answer any questions, and thank you so much.
Thank you, Kendra, and Commissioner Madrigal-Weiss and Heather Newmore. At this time, I would like to invite the commissioners to offer any comments or ask questions.
I have a question or a comment. I love that we're focusing on suicide, reducing suicides. I think it is very aligned with the behavioral health transformation and where we're headed. And it makes sense to me that the BHSSA dollars are, would support this work. I think there are other systems that should also be supporting this work. So like the budget issue is real, especially this year with the state budget the way it is. And I think the only other thing that I would add, like from our perspective, as I'm thinking about our priority populations, like, is there a way we can identify child welfare involved youth or juvenile justice youth in the demographics we're collecting, or homeless youth, for, those kind of system involved youth that sometimes are the most at risk for suicide, right? Or have the more adverse childhood experiences maybe than their counterparts. And
And it's probably a bridge too far, but I don't want to leave out our kids that are at risk for overdose, because there's definitely a correlation, or like I would hate to, I think this training and support could equally support youth at risk for overdose. And if there was some way to marry the two in the proposal, I'd love to see that. That may not be where we're at today, but I do think we have to think about those priority populations and the overlap between the risk for overdose and suicides.
Let me just say, this is my passion, right? As someone who struggles with their own mental health, even still, right? And then also being an educator for 13 years, this is something that I've seen in all of the schools that I've worked at in all of the districts. So let me just tell you guys, thank you for even bringing this to us. I'm inspired. I am definitely in agreement with you. I would love to see these go ahead and be married together. But let me just say thank you for bringing this up. This is coming from someone who has served as a para, a teacher, dean of students, assistant principal, and a principal. So thank you.
We have a commissioner online.
Yes, if it's my turn. I guess following up, Commissioner Larson, really interesting additions to the demographic data, and I'm wondering if those questions might be answered in the substance of this survey or the screening. Think questions about drug use and housing stability. So maybe, but yes, that should be captured. Absolutely. The other thing, and I just missed it, you had mentioned something early on in the presentation about a funding source, and it was behavioral health something, and I just missed it.
The Behavioral Health Student Services Act administrative dollars that the commission has. Part of this was presented this morning in PAC. It'll be presented in the Budget and Fiscal Committee as well.
Okay,
and
great.
January as well.
So that funding resides within the BHS OAC?
Yes, it's not part of the grants. It's administrative dollars, so it can be used for like technical assistance, which is what we're proposing.
Great. Wonderful. Thank you.
I just have a quick question now. In the training and when students are feel like they may be at risk of suicide, do you address the underlying problems, that there may be substance abuse disorder or abuse or those things, and are they sent to the correct or the proper areas to deal with maybe any underlying issues?
I think what we're proposing is it would be a suicide prevention online training. It would talk about risky behaviors, at-risk warning signs, those kinds of things. I don't think we would do anything standalone, so it would be in line with resources for. So I think we could include it as much as we want to include in that. So I know that there were resources included on the online one. They knew where to go, who to contact. If you have any concerns, immediate numbers, crisis lines, those things. So we would never do it standalone. And the beauty of this is that we would be able to set up the parameters for that. I think what is really critically important and why we really wanted to see something expand is because it was a good training. The big piece that was missing was access to parents. And so going back to that web of support, it's great that staff knew. It's wonderful that we included the students, but we didn't have the parents involved. And so we really want to make sure that we create something that's accessible to all in the lives of our students. And then again, we can set up those parameters. So we would absolutely do that.
Okay, so in a sense, it's a curriculum that is going to be used online, and it's for full wraparound services, right? With parents, staff, students.
Would have access to it, to a suicide prevention training, yes.
Okay, and then you'll also have the resources moving forward would there be like surveys also in this curriculum that can Like if you are feeling any of these symptoms,
We could develop the resources for them. Yes,
Awesome.
this is where you go to. So we could set that up, whoever is going to develop it for them.
Okay, thank you.
Yeah.
And one more question. Will there be any follow-up process after meeting with them?
So we're talking about two different things. We're
yeah.
talking about the training curriculum, which is one thing.
Yes.
And then the other suggestion is that we ask LEAs to track
Right.
suicide screening data.
Got it.
Separate thing.
Okay.
And at that point, it's asking additional information. And the additional information would be the student information, SIS, student information systems, where we could find additional information, right?
Okay.
Because we do want to know more about who, when, that. But currently, as a system states, there is nothing that mandates that we track that data.
Yeah.
And so what we have found is that we spend so many dollars, but we're still guessing. And let's make informed decisions based on the data. So that's the second ask.
Commissioner Hill?
I just want to say thank you. I really like it. I think anytime you enter, and I taught for some years too, and anytime you go into the schools and you bring information and training to support the students, it's a wonderful ideal. It took me back to a story way back many years ago. I was 14 years old, and they went through the schools and they taught the Heimlich maneuver, and that was part of the curriculum for the PE classes. We all had to learn the Heimlich maneuver, and lo and behold, within a week of learning, my little sister starts choking in front of me, and my mom is trying to figure out what to do. And if you were born in the 70s or something like that, before the Heimlich was widely used, you just beat somebody's back until whatever it was popped out, and maybe there was a success rate or not. But I immediately kind of did what I was taught in the class, and it popped out, saved her life. And I see this in the same way. Like, when we have more information and we know more as a group, we're better prepared just to support one another. So I think you're doing a wonderful job, and thank you so much.
Thank you.
Thank you. I think that's it for the commissioner comments. Lester, please go ahead with opening it up for public comment and open dialogue.
We have 2 public comments online. Laurel, please go ahead.
All right. Can you hear me?
Yes.
Okay. All righty. So the legislation proposal is apparently built on the San Diego program and the California Department of Education model. So is there enough data and other evidence, especially of fewer suicides, hard data, to suggest that the proposed program is evidence-based and effective? So are you considering other approaches and pilot projects or established evidence-based programs? And have you rejected them before choosing this particular San Diego and California state model? Will the programs and have the programs in San Diego been delivered in languages other than English? Will the approach engage students and families, not just parents, grandparents, because they are often the people that children go to when they can't talk to their parents? And suicide is certainly hard to talk about. So parents and families who prefer to communicate and learn in languages other than English on a topic like suicide prevention. Is the psychological instrument that was mentioned, used, normed, and available on the populations who speak any languages other than English? And would the screening tool be available in any language other than English? Why is a hard way to ask the question? So what's your thinking in having the program online and instead of in person? Some people do better with in person, but others don't want to talk about this subject, think about it, except maybe online. What age students would be trained? That's missing completely. How much per year do you plan to ask the legislature to budget for this? We haven't heard a number. In the current climate, does that number have a chance? You have addressed that some legislators are interested. That's good. But numbers are numbers. Given the current harassment of many immigrant and refugee families whose children are in public schools, this could be timely because this kind of harassment can lead to suicides. And so maybe other legislation funding focused on crisis care for children who have been impacted by hate speech and ICE actions. Really anybody these days, Hispanics, Afghans, Somalis, would be more timely. Thank you.
Thank you for those questions. If I could, yes, let me respond. So, just to be clear, this isn't based on San Diego's model. The examples of collecting the suicide screening data is just something that has been done in San Diego because we are one of the only counties that have collected the screening data. However, the best practice comes from the report that was generated from the commission. So we just started doing it. So I want to be clear about that. The Living Start program, the online training, that was something that was put forward in legislation, which was 1808, and it was done so with the thinking that an online training would get more accessibility out to school communities, and that's in fact what did happen. So the thought was to propose it forward so that students and staff would have more accessibility to it. Could it also be done in a different modality? That's something to be looked at, and we can definitely look at that. It is an evidence-based program. It does relate to other languages and other cultures, so that was something that was looked at during the RFP process, and I think that's something that would absolutely be looked at again. So it would be available in other languages besides English. As far as the screening tool itself, it is the Columbia risk screening tool, and that is done in other multiple languages as well. So that is the evidence-based tool. I don't think we would mandate any one tool. I think as long as it's evidence-based would be the recommendation, as is in the report that the commission generated, which is the Striving for Zero report. So that comes directly out of that report as well. So I just wanted to be clear about all those things. And absolutely agree with you. It should not just be for parents. The recommendation would be for caregivers. So anybody caring for a student, it should be made available to them. So if that wasn't made clear, I apologize. We want to be clear about that. Anybody who could be supportive of a student's life.
Well, thank you for addressing those. I know I had a lot of questions. So one that I still don't understand is what age student would be.
Oh, I apologize for that as well.
Yeah.
In 1808, it was middle and high schoolers.
Mm-hmm.
That's where it started. I think I think that's where it would likely start because that's what the data we have with the data. That's what's known. To go younger, I think that it would be more training recommendations are more for parents than it is for directly with students. So it would be for middle and high schoolers would be the recommendation for this.
And how much would the budget be per year?
I will leave that to Kendra.
Well, to develop the training, and like I said, we're hoping to use one of the state's platforms, which sounds like it's a viable option so that the commission isn't paying ongoing for the website or whatever it is. So I believe the funding this morning was 1.5 million, I think one-time funds. The part we need to work on is funding for the data portion of it. But the funny thing about California law is it requires schools to have this model suicide prevention policy, and the policy says schools have to do training and do the screeners. So it's kind of a roundabout mandate that they're already supposed to be doing all this. We're going to attempt to avoid mandates in this legislation because that is very hard to pass in the legislature. So we're trying to get creative here. More to come. We have a few months to work on this. So it's all in the sausage making, as they say, and I'm happy to involve you in that process.
Well, thank you. I do remember that in the first Trump administration, when the public charge rule was announced, we had 3 refugees, I believe all Afghan, but I'm not sure, who committed suicide. That's the wrong words, but I don't know the correct words. Anyway, upon hearing that news. So if we can prevent this, more power.
Great. Thank you.
Thank you.
Thank you, Laurel. We have 3 more public comments. The next comment is from Stacy. Please go ahead.
Thank you. Stacy Hiramoto, REMCO, the Racial and Ethnic Mental Health Disparities Coalition. Some of these comments are hard to make for me because I don't want to give the impression that I think this is a bad program, and it sounds like a really wonderful program. What my question is, I've been going to the legislative meetings, and there were so many proposals put forward. And I'm even looking at the minutes, and it said that staff will present the refined proposals at the November committee meeting, although it is noted that only 1 or 2 bills could probably be sponsored. What I don't understand is why aren't at least 2 or 3 proposals put forward so this committee could compare them? I mean, I know the committee's busy and the staff is even busier, but I just feel like this is a sort of going back to business as usual, where the public makes comments, but really the staff and the commissioners are going to call the shots. And if that's the case, then that's fine. Just don't get our public comment, because this morning, one of the commissioners asked a really good question. This morning, there was a vote in the program committee meeting that would fund this proposal that was related to something that would fund this proposal. And this proposal has not even been voted on, and you voted on that. And I'm thinking, this is kind of like, I mean, again, I'm not saying it is, but it seems like insider dealing, because, it was just a surprise to see something being voted on that way. The commission's biggest projects are the BHSSA and the Mental Health Wellness Act. Neither one of those, in my opinion, focus or even address reducing disparities. This one may or may not. I'm glad you said it's in different languages. I'm not sure how it promotes equity or reduces disparities, but again, I wish that at least 2 proposals, and it could have been brought forward, and the committee could have discussed it instead of just 1. Thank you.
I'll add a few comments. Thank you, Stacy. So all of the proposals, we got back to the person who submitted it. Like I said earlier, some of them we're still working on. I don't want to say which ones, because if those organizations want to go get their own bill, I don't want to say, bring up any issues ahead of time. But for example, one of them I suspect will be brought back next year as they do some of the legwork necessary to fully flesh it out. A lot of them were funding proposals without an identified funding source that wouldn't have really made sense to present. And this one, it just so happened that all the stars aligned, and it was our assessment as staff that it was time to bring it forward, but noted about bringing more than one. There wasn't really another as viable option as this one.
And Kendra, can I add too, just in terms of the processes too, because I think Stacey, you bring up great points, and just even as we've been working out how the flow works amongst the committees and stuff, and so it feels like, oh, we're having the PAC take a look at it before the Lex is even taken, or the BFA, and so but each of these committees kind of stands alone but yet works together, and so we're still kind of figuring out the flow, but the idea was PAC's looking at it from a programmatic perspective, as in, does this make sense? Does it align with the BHSSA? And so programmatically, they're looking at it through that lens. This is Lex, so it's a legislative lens. Tomorrow, BFA will look at it from a fiscal lens. So collectively, all these different perspectives then kind of put a different lens on it that then rolls up to the full commission. So hopefully that makes sense, but we're still kind of working through this, but that's what's made the most sense as we've been trying to make sure that we're giving the time and the consideration across the different committees with the different perspectives, so that we're putting all these perspectives up to the full commission.
So if Kendra says, well, it wouldn't make sense if it was just a budget proposal, are those going to be considered in the budget committee tomorrow? I mean, there's nothing that says that the commission, because you have in the past done things through the budget.
Yeah, I just mean in terms of like the decision-making framework in there is about, have you identified a funding source? Is it viable to ask for more money right now? It's not really. It'd be very, very difficult. In fact, what happened last year was we were fighting just to keep the funds that we had. So it's a very difficult time was what I meant. And that doesn't mean that some of those ideas can't apply for our grant funds, which we suggested to a lot of them. But for new money, that would be very difficult right now.
Yeah, it would be very difficult. Okay.
Yeah.
Right.
I do want to say a bunch of the proposals are not new. It's not like they had just been formed for this committee. They'd been around and then people submitted them through our process. So some of them have just been worked on more, or like our program staff were already aware of some of these. So that's how it came to be also, where there was this other effort in the program committee.
And I think too is like that viability thing. So that's not necessarily that other things won't be continuing to get worked on. It's just some things are going to take more time to work on. This one was most launch ready or ready to go right now, but the other ones can still be in play, I think is what Kendra was saying a little earlier. And were you going to say something, Stacey? I didn't want to cut you off. Okay.
Commissioner Fairweather has her hand raised.
Oh yeah, I just want to, if we can sort of hold those thoughts of Stacy in terms of, moving forward with this and any other legislative recommendation, that if we continue to think about it with the lens of equity and the lens of, those priorities, and, how it could be shaped further to meet those goals. And, I'm not an expert, but, it came to my mind that, the really comprehensive screening could demonstrate more need among, different groups, lack of access to care among different groups, that then could be used to address those issues. So, to just kind of like continually hold those in terms of shaping the legislation and shaping the rollout and shaping how it's used. But I always appreciate Stacy's comments.
Our next public comment is from Fernando. Please go ahead.
Okay, thanks. And this was just in regards to the program that you guys are developing and how it might be better implemented. I don't know if you're coordinating with the certified wellness coaches and that work stream that's coming out through HCI, but I know that they're doing some program development on how they would train parents and the family unit. So maybe there's an intersect on suicide prevention and that group, just so it gets further out there. And then also wondering if on the tracking of suicide data, if it's tying into the greater CDC syndromic surveillance system, or if it's independent. Just thoughts, and that's all I had.
Thank you, Fernando and Carlene. Please go ahead.
Commissioner Madrigal-Weiss has a comment.
Yeah, Fernando, no, I don't think we've tied it in, but I think it's definitely something that we could work on. And I just want to go back a little bit. I know we continued to move forward with this, but I want to be very clear that this project has been going on since 2021. And of all the 57 county offices of ed that received MHHSA funding, we were one of the only ones that did capacity building. And so we have been working toward lifting this up with the California Department of Education. We've been talking about tracking suicide screening data, making it something that all LEAs participate in. So this isn't just something that we've been talking about both with the CDE and with commission staff, in the last 6 months. This has been a long time coming. So I want to be really clear about that. There wasn't just, because the commissioner wanted it. This has been proved by data collection, sharing the stories of the process along with all 58 counties through MHHSA, because we get a lot of technical assistance and we have a lot of meetings and we all report to one another what's been going on. So I just wanted to be really clear about that. Secondly, the Living Works START program, again, we got that initially to be shared across the 58 counties during the pandemic. They extended that far past the time it was supposed to be expired because of the need and because they knew, here are the licenses, we have a pandemic. And the last priority for LEAs at that time was, let's do one more training for teachers when they were doing so many other things. The licenses expired finally in January of this year. Is it? Yeah, I'm sorry, January of 2024. And so we saw the need there because we kept getting asked for it and we kept getting asked for it. And so we have been saying we still need something like this. But then there was a cost. So it went from free to a cost. So we've been saying, wouldn't it be great? Wouldn't it be great if we can get a free training for staff, for students, caregivers, parents? And so that too has been a conversation that's been going on for a long time. So I want to be really clear about that. This isn't new. This has been a long time conversation. And in conversations with the Department of Healthcare Services, they have a wonderful program that they make available, which is the trauma-informed practices training called Safe Spaces. Thank you, Heather. I hear Heather right here. Safe Spaces. And so in conversation with them saying, we would love to have a suicide prevention training. How do we do it where we hold it and it's free to the state and it sits at a state website and we're not going to lose it because it belongs to somebody else. It has to belong to California. It has to be free. And so all these things. So when Kendra says the stars aligned, they did. But they didn't align in the last 6 months. They didn't align a year. This has been going on for a long time. So to Stacy's remarks, I appreciate, thank you for asking them. Thank you for stating them. Thank you for making them, because it really helped me be able to say these things and just be really clear that this has been a long time coming. So thank you. Thank you for letting me say that. And thank you to Fernando. We will look into that because it is very important that we track this and we track it right, and we make sure that we want to do this right, because this data is too important. We don't want to lose one more child because we can't monitor where we need to be paying attention. So I appreciate that. Thank you.
Great. Thank you, Commissioner. We have one more public comment.
Hi, yes, Carlene Davis, California Black Women's Health Project and California Reducing Disparities Project. And so there has been mention that this is an evidence-based program. And I'm wondering to what extent that Black youth were part of that evidence. Was that evidence disaggregated by race and gender? Because in fact, from about 2007 to 2020, the suicide rate for Black youth has risen by 144%. And so, for a program that's evidence-based, I would want to know that more than 6% of the students served were African American because our population is small, but we are overrepresented in suicides. And so, my concern is what is the equity in outcomes? Not like, oh, we serve 6% Black students. No, where is there parity of outcomes? So I would be interested to know that and to make sure that that data is being tracked. If it isn't already, it may be. This is my first time hearing. So you may already have all of that information, which would be wonderful.
Thank you. I appreciate it. Again, just to be clear, we're not talking about a program. This isn't a program. It was two different things.
Okay.
We're talking about we want to make available a training curriculum, a training program accessible online. So that's the one.
Yes.
And the second one is we want school districts to track suicide risk screening data.
Okay. And whether that's the curriculum, you said it's evidence-based.
Right. The tool.
So the tool is evidence-based.
Correct.
By whom? That's always by
that's Columbia.
Just showing
Columbia University.
Yeah. Well, just want to make sure.
Yeah.
That.
No, I appreciate it. Yes. So that's the tool that's the tool that we used, and we would just suggest that any screening tool an LEA uses be evidence-based. And we have not defined all that, but we would be very clear to define it. So we just shared the one that we used, which was the Columbia Suicide Severity Level Screening Tool. So that's one. And then regarding the online training, Living Work Start is the one that we used, but it was identified through legislation 1808. And so we're just naming the one that we used through the RFP process.
I would just want to make sure that any tool works for Black students.
Absolutely.
That's my bottom line. Then
and I hear your bottom line.
Yale, Berkeley, Go Bears. Does it work for Black students?
Yes.
And because our numbers are so small in the state,
that's right.
There's often a tendency for us to become very marginalized, and so evidence-based does not always accurately represent the needs of Black people. I just want to lift that up.
Thank you.
Okay. Thank you. That was our final public comment.
Thank you, Lester. Now that the public comment has closed, I would entertain the motion that the Legislative and External Affairs Advisory Committee recommends that the full commission approve sponsoring a bill for sustaining and supporting suicide prevention in schools for the 2026 legislative session. So moved.
Do we have a second if you're moving the motion?
Yeah, I'm moving.
Okay. And do we have a second?
second.
Thank you.
A second.
Thank you. We have a motion and a second to approve the sponsoring of a bill for the suicide prevention in schools. Are there any additional questions or comments from commissioners?
I'll just say one additional thing. I'm so glad we had the public comment because it helped me understand what's being proposed today more than I did just through the presentation. I mean, you guys did a great job. It also helped me realize that because I'm always so focused on how can we make things better, that sometimes I fail to say how amazing this is. So thank you for bringing it in front of us and all the work you've done along the years to get to today. I'm really just so grateful for the folks who show up online or in person to have this dialogue because it helped me make a more informed decision today. So I appreciate it.
Thank you.
Great, thank you. Do we have any more comments from commissioners? Okay, seeing that there are no more comments from commissioners, Sanji, please call the roll.
Commissioner Fairweather,
Aye.
Commissioner Hill,
Aye.
Commissioner Larson,
Aye.
Commissioner Mitchell, marking absent. Commissioner Southern, marking absent. Commissioner Thomas Beckett,
Aye.
Committee Vice Chair Callan,
Aye.
Committee Chair Bontrager, marking absent. The motion passes.
Great, thank you. We will now proceed to agenda item 6. This item includes an update on the development of the BHSA Stakeholder Toolkit, which is being created to support and enhance public participation in the community planning process. I'd like to invite Assistant Deputy Director Ryan Kompchak to present. Ryan. Welcome, Ryan. Please go ahead.
Thank you, Vice Chair. If you read it, you can't say it right. That's the thing with my name. Thanks, Mom, if you're watching. First I want to apologize. I'm going through some laryngitis issues, but I'm going to do my best to yell into this microphone because I think it's really important that we see this presentation today and hear what we've been doing, what great work my team's been doing. Again, thank you for being here today. Thank you, community, for your time. And I'm going to talk a little bit today about the BHSA Community Planning Process Stakeholder Toolkit. So we've been discussing this in previous committee meetings, and it's in response to community requests to better understand the BHSA community planning process, right? And Cal Mesa came out with their version of the guide from the county perspective. And so the commission decided, and DHS, we worked with DHCS to build a toolkit from the community side, right? And really help community members get involved in these intricate government processes. So our project goals were that we really wanted to build an accessible plain language guidebook to help community members. So as we're going through this, and once I show you some of the content, you'll understand what I'm saying, but we really wrote this in plain language at an 8th grade level, which is what we strive for in our work with the community. We wanted to first help partners understand and engage in the process, support community voice in planning and oversight, and then also promote equity, transparency, and accountability. You'll see those themes as I go through the presentation. A huge part of what we've done is community engagement. So we've talked to folks at the Health and Human Service Agency, the Behavioral Health Planning Council, Department of Healthcare Services. We reviewed the Cal Mesa toolkit that's being prepared for counties. And so, sorry, I got distracted. And we mirrored our toolkit on their content, right? So the Cal Mesa guidebook really goes through the who, what, when, where, how to create their content. And so we mirrored that in ours as well, okay? We attended community planning webinars and county planning meetings. We physically went to different counties such as Nevada County, Sacramento County, and other local counties to attend the meetings ourselves. We did that both virtually and in person. We also wanted to we had staff attend some anonymously because sometimes things change when we show up, right? And so we're aware of that. And so we wanted to experience those on many different levels. We solicited feedback from partners on current processes. That is county partners, community partners, CBOs, government organizations, things that we were hearing from commissioners. And we did partner interviews. Those were completed by November 20th. We met with, I think there was over 15 different organizations and people that we had specific interviews to before the content of the guide was written. What's going to be helpful? What are people really going to be able to use? We also held 2 listening sessions, one on November 6th and then a second on December 11th. So our November 6th listening session with the community, we had over 70 folks attend, and the feedback we got from that was a lot of we don't understand at all what this is about, and how do we actually find out where information is. They also gave us some tips on what would be helpful for them to put in this guidebook. So as a result of that, we included a glossary of terms, right? Things that we work in every day, acronyms that we use every day that folks don't understand at all. They go to these community planning meetings and they get lost in the alphabet soup. So we included that. We also did what is kind of one of the better parts of the book, I think, is a myth and fact section. And it talks about things that the community told us, reasons why they don't go. And a lot of it was like language access. And we said, well, they have to provide you an interpreter. You just have to ask. And people didn't know, right? Also, counties are required to assist people in getting transportation or access to those meetings. People didn't know. That's in our myth and facts section. Another big one was, well, why are you guys doing this so late? The plans are done in, March. The drafts have to be submitted. And we said, well, they have to relook at these every year. And they have to re-engage with the community every year. And so this is your opportunity starting now. But yeah, every year you're going to get to, inform this process. And so we took all of that feedback. And in December 11th, we presented all of that to them. Okay, this is what we heard from you. This is what we included because you asked us to. We had, I think, 50 attend the December 11th meeting. And then the big theme that we had there, which we also had an interpreter there translating into different languages, or a different language as a request of one of our community members. And we heard a lot about language access. They liked what we showed them, which I am going to show you guys a preview of the toolkit. And then they loved it. No comments on the design at all. The only thing we heard was we need it in different languages. So as a result, we explained to them our first iteration of the toolkit is going to be released in January, and we're going to release that at a webinar to get more feedback. After that's finalized, then we're going to put that into different languages, and not just threshold languages. That was another thing that folks said, a county threshold language is great, but there are folks there that don't speak a threshold language. So we took that feedback as well. And that's the final listening session that I was referring to for January 2026. So our toolkit outline, we based it on, like I said, just like Cal Mesa, the who, what, when, where, how. So we started with a when to advocate, and then we linked to, there's a link in the toolkit to every county site where their calendar and their contact information is, so people can just click on that link and find out where they can go for their county meetings. And we talked about the 3-year and annual cycles. I touched on that a bit. Oh, seems to be off a bit. Here we go. And then the where do you go? We talked about who's responsible in each county for the community planning sessions. Some are virtual, some are in person, and that you do have options to get assistance with train or transportation, interpreter services, other resources to get to these meetings. How do you advocate? Another cool feature, I should shout out, we worked with a project coordinator, Program 11, on this project. They did a fantastic job of coming up with some worksheets that are in the toolkit for people to actually print out, and so they can feel more prepared to go to these meetings. I'm going to share one with you later. And then we provided some guidance on strategies also through those worksheets. Finally, we're going to telling them what they can ask counties for. They can ask for technological assistance, accessibility, if they offer stipends, what ages. So we found out that Orange County is doing something really cool, and they're actually holding community planning sessions in different languages. So they had a full meeting for folks that of Cambodian descent that only spoke those languages. They had, different populations within their county that are represented. So we thought that was a really great thing to highlight, Orange County. What we really wanted them to ask their county, build a relationship, find out what meaningful participation and partnership looks like. We're not just going to these meetings to show up. We really want to make this stuff work for folks. So this is like the little guy, the preview of just the colors. Right now, these are placeholder images. The designer's not done incorporating all of it, but we are gonna, we want, different folks to be represented, different groups to be represented here. But this is mostly just so you can see color and layout. We have a section here that talks about the intention for the toolkit, what it's for, what it's about, talks about community planning processes, the Behavioral Health Services Act, and different things just to give them an explanation. But it's also in very large font, right? So it doesn't look like that on your tiny little screens, but I promise you, in person, this is written in larger than typical font, very plain language. This is a sample page of content. This is relative to the integrated plan. So this is where we go into describing what the integrated plans look like, and then tying it all back to the community planning process. We do use a lot of bullet points, so it's not a lot of text. Research has shown just that folks don't like to open something and have to read just word upon word upon word. So we really took the approach of making it accessible. Primarily, this is going to be a digital toolkit for folks to use, but it will have a printable format as well that people can print out and have for reference. This is one of the pages. So this is the beginning of the what. What is the community planning process? It talks about the community planning process is usually shortened to the CPP. It is the process every county in California must take in. And so we didn't bulk it up with a lot of like statutory language, things like that, right? So we really need to keep in mind who the target audience is for this, and it's the community member. This is one of the participation scripts. That's a worksheet meant for people. So I'm going to go like this so I can read it. Meant for folks to print out and take with them or prepare themselves for their sharing at a community planning event. So it talks about after you've decided what you'd like to talk about, you can use this template to create your script. And so it actually gives them sample language, right? My name is Ryan. I live in Sacramento County. I'm here because my family has been affected by the following challenges. It really gives them like a script that they can read off, because when folks have not a lot of experience giving presentations, they really get nervous and scared, and then they think they're not going to be taken seriously. They don't know the language to use. So I thought this was just really helpful. And then, the program should be included in funding, and then identify the gap, right? For people who have this issue, we've had trouble doing this. Tell us what the problem is, and discuss your experience in 30 seconds. So be brief, which I'm not doing a very good job of right now, but we're telling them that, be concise, to the point, right? And that way, too, we all know that when folks are talking about their behavioral health challenges, they tend to get a little emotional. And so if you're brief, you don't have the chance to get emotional, right? You get your information out, and then you can relax a little bit. And then always suggest a solution. We're like, you want to always go to these meetings with intention, with purpose, and present a solution. And then in closing, we always want to thank everybody for their participation and including the community voice. So that's just one of the several worksheets that we have. There's also like checklists of ways to prepare, things you need to take with you, be professional, wear clean clothing, like professional attire, things like that. So I just thought that was kind of a cool inclusion in the script. So our next steps. The interviews with the partners are already done. We had our listening sessions, so we're moving through the process. Our first draft delivery we did get on December 1st. We provided internal feedback. We had the listening session on December 11th to debut it to the community. They saw some of the pages that you just saw, and we got feedback there. Everyone loved the design. We had no feedback on that. We did go over a glossary of terms with them. They had some requests for us to include certain terms. Earlier intervention was one of them. Cal Mesa, I think they didn't know exactly what that meant, so we're adding that as well. So things like that. And so we really want, when folks give us feedback, if we can put it in there, we want to put it in there, right? And then our final project delivery is going to be January 23rd. And we're going to do like a webinar to kind of debut it, and then it'll be available on our website. We'll email the link out through our distribution list and hold that listening session, and then we will accept feedback on ongoing assessment and refinement of the tool so that future iterations can be more inclusive and perhaps develop as we move away from the initial planning phase into the bolder and annual cycles. So that's all I have for you guys. I'm happy to answer any questions, feedback, anything I can.
Thank you, Ryan. At this time, I would like to invite commissioners to offer comments or ask any questions.
Ryan, thank you for making this so easy to understand, especially to our constituents, right? Thank you for making it inclusive to any and everyone. Thank you for also making sure that you guys are going to put it into different languages too. So thank you to you. Thank you to the team. I think you guys have done a phenomenal job thus far.
Thanks, Ryan. Thanks for doing this when you're feeling under the weather too.
Yeah,
So
right.
I love this. I'm wondering if there's a way to include like ongoing community engagement. Like I know we're talking about the community planning process, but because we're a little late for this first plan, there are other ways to be involved, like going to the local behavioral health boards and commissions to give them feedback about how things are being implemented or what have you, or providing public comment at Board of Supervisors meetings or City Council, whatever the case may be, that maybe there's a way to broaden it beyond just the community planning process for BHSA, make it a little broader. So even though we're a little late in this first iteration, they have opportunities to be engaged, to practice some of the skills. I love the tools that are included to help people with the script and things like that. So thank you.
Yeah, I wrote down kind of an other ways to get involved, kind of a page maybe. Okay.
Commissioner Fairweather?
Yeah, it looks great, Rianne. I'm assuming it will have, also all the million-dollar definitions of, what is an FSP and that stuff, because that can be confusing. And then the only other thing, it looks great though. You said, so the webinar is going to be on the 23rd of January, and is that the second day of our 2-day meeting? And I guess the webinar will be recorded.
So we are supposed to get the final draft from the copy editor on the 23rd. We will absolutely schedule that webinar shortly after that to make sure that everyone can attend.
Great. Okay.
And I'm not sure, I think we were even planning on maybe talking about it at that commission meeting. I think it's an agenda item at that commission meeting as well.
Great.
Great, thanks. So can't see online. Are there any more online commissioner comments or questions? Oh, Commissioner Hill.
No question. Just thanks for all the hard work, Ryan. Looks good.
Thank you, Ryan. Congratulations. That was a lot of work. It's amazing. Now, Lester, please go ahead with public comment and any open dialogue.
Vice Chair, there are no public comments. Oh, never mind. There are 2 public comments online. Stacy, please go ahead.
I just didn't want to go first and be hogging the space. Sorry, that's why I lag behind. I just want to commend Ryan and the commission for doing this. This is so important. I've tried to do it with groups myself, and I really think that people need more than, they need to hear it more than one time. And this is a wonderful that you're putting this booklet out, and I think it's going to be very helpful. And I really like the suggestion of Commissioner Larson to put some suggestions of ongoing action or involvement with like the local mental health boards and the Board of Supervisors. But thank you, thank you, thank you.
Thank you, Stacy. And our final public comment is from Laurel. Please go ahead.
Hello again. So, yes, this sounds like a great project. Just a few suggestions. Be careful if you're thinking about using auto translate for your materials. You can, there are pitfalls. You really need a human trained, like professional translator to at least be the final word. And actually, I would say you need to pilot your languages other than English versions with some of the people in the group that you got together and others, because we have, well, for example, with Punjabi, it is written in two different scripts, one in India, and really, I think by 6 all over the world, and then another script in Pakistan. So legibility is important for that particular language. The other would be the care in the use of technical terms that may not occur in the language of the speakers who speak languages other than English. Are the translated terms even used in that language? Are people familiar with them? And that's what you'll get if you do a pilot and feedback with those translated versions. You'll find out. They'll say, we don't use this word. We've never heard of it. I've been urging the Care Court Working Group to do this for, I guess it's more than a year now. And they have just come out with auto-translated, I think. I haven't really reviewed them. I haven't had any of my colleagues review them. But versions of certain training materials and other items. And I'm waiting to see if people actually understand them. Yeah. This is a new tool. Well, it's been, machine translation's been worked on for decades, but being used the way it is now is a little bit different and newer. So those are just some tips. Thank you very much. Good work.
Thank you, Laurel. And that was our last public comment.
Thank you, Lester. Now, agenda number 7, adjournment. I just want to give a heartfelt thank you to our commissioner, staff, community members, and everyone else for being with us today and for your continued support. Now, as we wrap up for the year, I want to wish all of you a joyful and restful holiday season. We look forward to reconnecting in the new year and continuing in this important work together. Our next meeting will likely be on February 19th, 2026. Since our 2026 legislation session begins on January 5, we expect to bring forward introduced bills to potentially recommend the Commission take a position on at this meeting. With that, this meeting is now adjourned. Take care and happy holidays.